Finally, I want to take a minute today to talk about schools, and I'm joined by Commissioner Infante Green. Last month, I set a goal for the state to return to school, in-person school, on August 31st. And we asked each school district to please prepare plans for that to happen. We asked for multiple plans because we need to be prepared for everything. Life changes every day. We asked for a plan for full in-person return to school. At the other extreme, full distance learning, if we have to go there. And then plans for in the middle for a hybrid of partial in-person, partial distance learning. I want to begin with a thank you. Every city and town met the deadline and had their plans in by Friday. I recognize that was an extreme amount of work in a short period of time, so thank you for getting the job done. I've had the opportunity to talk with superintendents and teachers, charter leaders. I've talked to lots of you. I've been on lots of Zoom calls, and I know this is a heavy lift. So thank you for getting the plans in. The plans were of varying quality levels. Some of you really worked overtime, it's clear, and you were unbelievably creative, and I want to thank you for that. Others of you did a good job, and we're going to help you get from where you are to a more complete plan. And by the way, we're learning from each other. Some of the plans we received were so creative, and we're going to take from those and share it with everyone else so that everybody is in a good place. The Department of Education and Department of Health are reviewing every single plan and plan to be in touch with every single district to help you do what you need to do in your district in order to get kids safely to school. Now, I want to make a few comments about this. There's a huge amount of misinformation out there right now, and frankly, a lot of fear-mongering from everywhere as it relates to the risk to our kids of going to school. And I'd say very candidly, I was disturbed when the Trump administration said last week that they weren't going to let science influence the decision around schools. So from the beginning, I have endeavored not to be political, and I'm going to not be political now. We are going to get our kids back to school. We're going to make sure they're safe in school, and we are going to follow the science. So I'm asking you, I want to speak to parents, I want to speak to teachers, I want to speak to students. Don't let anybody scare you. We're going to follow the science here in Rhode Island. I can't speak to what's going to happen in Washington. I can't speak to what's going to happen in the rest of the country. Here, in our communities, we're going to follow the science. We're going to do the hard work, the painstakingly difficult, detailed work of readying our schools and our buses and our communities so that when we say it's time to go back to school, we will know it is safe for you to go back to school. In fact, you'll be safer in school than not being in school. And we're going to let science guide those decisions. We're going to let science guide us around the virus, and we're going to let science guide us around the social, emotional, mental, intellectual needs of our kids to be in school. And we're going to do everything we can possible to make sure that our kids are safe and safer in school. And that means thinking about children's educational needs, nutritional needs, social needs, mental health needs. This is very complex, and we can't minimize it. We can't minimize how difficult it is, and we can't minimize how much of a long-term cost it could have on our children if we don't get them back into school. So I don't have all the answers. As I stand here today, I do not have all the answers. And there are big challenges. How do we deal with transportation? How do we deal with cleanliness? How do we deal with children with special needs? On and on and on. And here's what I can tell you. We're going to work every day between now and the end of August to figure out answers to these questions. We're going to talk to pediatricians. We're going to talk to public health experts. We're going to look at what's happening in other countries, some of which are doing a very good job. We're going to learn from them. What we're not going to do is fall into fear-mongering or politics. We're just going to keep our head down and do the work necessary. And what I'm going to do is to start to talk about it more and share with you our plans as we go forward. So every week, starting today, I'm going to end with talking on the Wednesday press conference. I'm going to dedicate a portion just to talking about schools. We want this to be transparent and fact-based for every parent, student, and teacher out there. I'm going to be joined by the commissioner every week. And we're going to start to answer your questions around how are we going to do testing? How will there be adequate testing? What is an outbreak? When will a school have to close? How are we going to make sure that no one is ever in a school with any symptoms? So I understand it's a long list. We're going to take a breath, and we're going to, starting next week, go through systematically every week to get the facts out there. In the meantime, we're going to be working town by town to do the hard work, to do the logistics and the practical planning. From the beginning, we have said facts, not frenzy. Let's hold that with us now. Facts, not frenzy. We owe it to our children to get them back to school. We owe it to them to do it safely. We owe it to our teachers to make sure they go back to a work environment that is safe, and we're going to get that done. I also, in addition to dedicating a portion of the Wednesday press conference every week and having the commissioner with me, starting tomorrow, every Thursday at 3 o'clock, the commissioner and I will be hosting a virtual forum on schools with different stakeholders. So starting tomorrow at 3 o'clock and every Thursday at 3 o'clock from now on, the commissioner and I are going to have a virtual forum to talk just about schools on my Facebook page. And we'll be joined by experts at different times. The first one will be tomorrow at 3 o'clock with 2 pediatricians. Pediatricians have a lot to say about this. We'll be joined by the fabulous Dr. Jim McDonald, who's been a very familiar face at these press conferences. I've actually heard from some of you that you missed Dr. McDonald. He's a pediatrician. He's a public health expert. He'll be with me tomorrow at 3. And we'll also be joined tomorrow by Dr. Elizabeth Lang, also an amazing pediatrician and former president of the Rhode Island chapter of the American Academy of Pediatricians. So in addition to this, Thursday, we will have every Thursday at 3 a regular event. And then we're also on Fridays going to have a special edition of the daily email entirely focused on getting back to schools. So if you're a parent who hasn't yet signed up for these daily emails, now is a good time to do that, because starting Friday, every Friday, these emails are going to just talk about schools. And you can sign up for that at governor.ri.gov. Again, this is an anxious time, and I appreciate that. As a governor, as a mother, I appreciate that. And so we're going to do our best to communicate more, base it on the facts and the science, listen to you, hear your anxieties, and together get ourselves to a place where we can safely return kids to school.